Hello everyone, this is Michian again, and in this video I'm going to give you some tips on how to make suggestions and recommendations in writing an incident report. So first you will have to refer to page 126 of your course material. Well, basically here it says the passive voice is widely used in giving suggestions and recommendations when you want to emphasize the action rather than the doer of the action. When you use the passive voice, it makes your report more objective and formal. So you can take a look at these two examples here. Number one, is recommended that a working party should be formed to investigate the problem. Two, it suggested that fire drills could be organized on a regular basis. So in these two sentences, modal verbs are used in the DAC clauses to give suggestions, and should and could are always used to give advice on how to improve a situation. Well, you could also use the active voice for formality. And take a look at these examples that start with a subject like we or I. So you could make sentences like these: we recommend, propose, suggest that the company forms a working party, blah blah blah. I recommend something. I believe that something should be done, and the company should do something. So please notice the sentence structures in these sentences. Say, for example, number one, when we use the word recommend, we say, we recommend somebody to do something, or we recommend that something should be done, or somebody does something. When you use the word suggest, we say, we suggest that somebody does something, or something should be done, or we suggest doing something. Well, there's a common mistake that students in Hong Kong always make. Some students say, we suggest somebody to do something. Well, this sentence structure is actually incorrect. And again, you say, we suggest doing something, or we suggest that somebody does something, or something should be done. While you say, I recommend somebody to do something, or I recommend something. As in the second sentence. And of course, you can make a simple sentence like this by saying somebody should do something. Now, I'd like to draw your attention to the SMART rules for making recommendations. Well, SMART is actually an acronym. So SMART actually stands for S stands for specific and measurable, A achievable, R result-oriented, and T time-bound. So you can take a look at these examples on the next page to give you more ideas of how to make use of the SMART rules in making recommendations or suggestions in writing an incident report. Well, I actually assigned this as homework, this exercise as homework earlier, so you could retrieve the answer key from OLE. Now I'd like to say something regarding the fishbone diagram, which is useful to help you brainstorm ideas to make recommendations. So you can refer to these slides from the PowerPoint that I uploaded to OLE earlier on using a fishbone diagram to investigate an incident. Basically, a fishbone diagram is a cause and effect chart that can always help in understanding and investigating a hospital incident. It provides a tool to help identify all possible causes of a problem and not just the obvious ones. It assists to locate the root of the problem from a systematic perspective. And it doesn't help us to understand the cause of problem clearly, but also helps us to make better recommendations to prevent similar incidents. Well, basically, a typical fishbone diagram normally includes 6 areas relevant to analyzing a clinical incident, and it looks like this. And the 6 aspects are materials, equipment, method, people, measurement, and environment. Well, I'll use Bell Chan's example to illustrate how you can use the fishbone diagram to bring some ideas for making recommendations. You might want to refer back to the case, to Bell Chan's case on page 124 and 125 of your course material. Well, guys, sorry I made a mistake. So these ideas are actually based on Fiona Yoon's case. So you will have to refer to page 110. Page 110. So if you refer back to page 110 of the transcript regarding this point on people, here it says Fiona at the time when she gave a chemotherapy injection to the patient, she was not assisted by any of her colleagues with the operation. So you might come up with ideas like we should increase the number of nurses on duty to 3 in the ward. Or limit the number of nurses who can apply for leave. So basically, you can think about the allocation of human resources in the ward for people. And regarding materials, actually the patient's mental status was not mentioned in his medication card. So you could come up with a point like this. The patient's mental status should be mentioned in the medication. Regarding equipment, since the patient has some emotional problem, so you might say physical restraints should be used for patients who are emotionally unstable. So method refers to the way in which a patient is handled or in which an operation is performed. So you might say something like this. We should assess a patient's mental condition if a patient shows any unusual behaviors or emotions in the future. Regarding measurement, so you could talk about the time constraint that doesn't really allow nurses to spend a long time on an operational procedure. So you could come up with a point like this, it's suggested that the normal checking time should be extended, say, from 10 to 15 minutes to, say, 20 minutes. Well, you might have noticed that your recommendations might not be able to cover every aspect of the fishbone diagram. Well, it's not necessary to. So you're actually recommended to come up with, say, 5 to 6 suggestions for each case. So this applies to the assignment and also to the exam as well. So as a practice, I want you to refer to Bao Chen's case, and try to practice the use of the fishbone diagram to make recommendations for based on the 6 aspects: materials, equipment, method, environment, measurement, and people, to make recommendations. Later, I'll upload the suggested answers to OLE for your reference. So I hope you find this video useful. Thank you for watching. And please let me know if you have any questions regarding this part.